Now we'll see the dental burrs. A burr is a rotary cutting instrument which has a bladed cutting head. If you see the burrs according to their shape, one is the round burr, which is spherical head shape used for initial cavity preparation and the placement of the retention grooves and also for caries removal. Next, we'll see the straight fissure burrs. This burr has an elongated cylindrical burr and it is used for preparing the walls for amalgam cavity preparations. Next, we'll see the inverted cone burr. The inverted cone burr has a head shaped like a portion of a rapidly tapered cone with the apex of the cone directed towards the burr shank. This burr is used to provide the undercuts for amalgam cavity preparations. Next, we'll see the tapered fissure burr. This burr has a tapered cone shaped head with a small end of the cone directed away from the burr shank. This burr is used for inlay and the crown preparations. Next, we'll see the pear shaped burr. The pear shaped burr is like an elongated inverted cone burr with rounded edges. It is used for amalgam cavity preparations to produce undercut preparations with rounded internal angles. Now we'll see the modifications in the burr design, and presently we have the three major changes. One is the reduced use of cross-cut burrs as they produce unduly rough surfaces at high speeds. Next is the extended head lengths for effective cutting with extremely light pressures. Next is the rounding of the shaft tip corners of the burr head to create rounded internal line angles in the cavity preparation. Next, we'll see the designs of the dental burrs. They usually occur in even numbers, and that is the burr blades, the uniformly spaced projections on the burr head which terminate in the cutting edge. And they have two faces. One is the blade face, that is the surface of the burr blade on the leading edge of the burr, and the blade back is the surface of the burr blade on the trailing edge. If you see the radial line, it is nothing but the line connecting the center of the burr and the blade. Then what is rake angle is? This is the angle between the rake face and the radial line, and it may be negative, 0 or positive. And what is clearance angle is? It is the angle between the clearance face and the work, that is the tooth. And the blade angle is the angle between the rake face and the clearance face. Now we'll see what is positive rake angle is and its importance is. The rake face trials the radial line is a positive rake angle as it increases the cutting efficiency of the burr, but it clogs the cut debris in the flute space. Now we'll see what is negative rake angle is. The negative rake angle when the rake face is ahead of the radial line is a negative rake angle. But it reduces the fracture of the cutting edge, thus increases the life of the burr. Now we'll see the zero radial line is, that is zero rake angle. Here the rake face and the radial line coincide with each other, and it also helps in resisting the lateral forces. Now we'll see the concentricity and the runout of the burr. The concentricity is the measure of the symmetry of the burr head when the burr is static, as it indicates whether the blades are uniform or not. And the runout is a measure of the maximum displacement of the burr head from its axis of rotation when the burr in its motion. Now we'll see the restoring instruments. The restoring instruments consist of the Siemens spatula, which have the flat and wide nib with a blunt or pointed edges. They may be single or double-ended instrument, and the primary use of it is to mix the dental cements on the glass slab or the paper pad. Next, we'll see the plastic filling instruments. These are also called as cement carriers. as they used to carry the mixed cements into the prepared cavity. They may be double ended and having the flat nib with the blunt edges on each end. They are Teflon coated as they used to place composite resins. Next, we'll see the amalgam carriers. These are the instrument used to insert the mixed amalgam into the prepared cavity. And they are also used to carry some of the packable composite resins and the carriers with plastic cylinders. Next, we have the condensers. They are available as hand or mechanical instruments. Presently, only hand condensers are in use. They used to compact the amalgam and the direct cold or the composite resins into the prepared cavity. Next, we'll see the carvers. In that, the Holenberg carver are having the sharp edges on the tips of it. They are used for carving the occlusal, proximal, facial, or the lingual surfaces of the amalgam restorations. They are double-ended and binangle instruments with their nibs either beveled or knife-edged. Now we'll see the cleoid discoid carvers, which are double-ended. One end is like claw-like while the discoid end is the disc-like in appearance. They used to carve the occlusal portions of the amalgam restorations. Now we'll also see the Fram's carver, which is also known as a diamond carver, as it is has the diamond-shaped nibs. This is also very useful in carving amalgam restorations. All the carvers are used to have the sharp blades and may also employed for carving inlay wax while fabricating the wax patterns. Now we'll see the finishing and polishing instruments that have the abrasive finishing strips, which are handheld flexible strips of metal or plastic coated on one side and with abrasive particles like aluminum oxide, used for interproximal areas. Now we'll also check for the finishing burrs and points and also the brushes and the mounted rubber and the coated discs. These are used for finishing the composite and the GIC restorations. They are very fine diamond abrasives. Next, we'll see the hazards of the rotary cutting instruments. One includes the pulpal damage. This may be due to the mechanical vibrations or heat generations due to the high speed. They may be in the form of the desiccation and the loss of dentinal fluid. And that's the reason the remaining dentin thickness is an important factor in deciding the pulpal response. Next, we'll see the damage to the soft tissues. The lips, tongues, and the cheeks of the patient may be injured if proper care is not taken during the cutting. This could be due to the lack of the access and visibility. Next, we'll see the damage to the eyes. This may occur due to the airborne particles such as the bits of the old restorations, tooth debris, etc., which have been discharged at high speed from the patient's mouth. And we also see the inhalation dangers due to the removal of the old amalgam restorations, which leads to the release of mercury vapors and also the monomers during polishing or the removal of the composite restorations. This causes irritation and tissue reactions in the lungs.